Welcome back our fans. Branches in infraorbital canal. 1. Middle superior alveolar nerve. Branches off the main trunk within the infraorbital canal to form a part of the superior dental plexus. Composed of the posterior, middle, and anterior superior alveolar nerve. MSA provides sensory innervations to the two maxillary premolars and, perhaps, to the mesiocacal root of the first molar 28%, and supplies pulp, buccal mucoperiosteum, investing structures, alveolar bone and period ligament. Authors found that MSA nerve to be present in 72% of the specimens examined. In persons without MSA nerve, its usual innervations are provided by either PSA or ASA nerve, most frequently the latter. 2. Anterior superior alveolar nerve ASA. A relatively large branch is given off the infraorbital nerve, it descending within the anterior wall of maxillary sinus. It provides 1. Pulpal innervations to the central and lateral incisors and canine, and 2. Sensory innervations to the periodontal tissues, bone, and buccal mucous membranes of these teeth. ASA nerve communicated with MSA nerve and give off small nasal branch that innervates anterior part of nasal cavity, along with branches of pterygopalatal nerves. Branches on the face. Inferior palpebral branches provide sensory innervations to the skin of the lower eyelid. External lateral nasal branches provide sensory innervations to the skin on the lateral aspect of the nose. Superior labial branches afford sensory innervations the skin and mucous membrane of upper lip. Dental plexus. The actual innervations of individual roots of all teeth, bone, and periodontal structures in both maxilla and mandible derives from terminal branches of larger nerves in the region. These nerve networks are termed dental plexus. 1. Superior dental plexus is composed of smaller nerve fibers from the three superior alveolar nerves. 2. Inferior dental plexus in the mandible, from the inferior alveolar nerve. Three types of nerves emerge from these plexuses. Dental nerves give pupillal innervations of all teeth. Interdental branches perforating branches provide sensory innervation to periodontal ligaments of adjacent teeth through alveolar bone. Interradicular branches provide sensory innervation to periodontal ligaments of adjacent roots. Sphenopalatine ganglion. Type: parasympathetic ganglion. Site: in the pterygopalatine fossa suspended from maxillary nerve by two twigs. Roots entering the ganglion. Sensory root is the maxillary nerve passing without relay. Sympathetic root, deep petrosal nerve passing without relay. Parasympathetic root, greater superficial petrosal nerve with relay in the ganglion. Branches of the ganglion are the branches of pterygopalatine nerves. 3. Mandibular nerve. It is the largest branch of the trigeminal nerve. Type: mixed nerve with two roots. Large sensory root. Smaller motor root. Origin: sensory root originates at the inferior angle of the trigeminal ganglion, whereas motor root arises in motor cells located in pons and medulla oblongata. Course: the two roots emerge from the cranium separately. Through foramina valley, the motor root lying medial to the sensory. They unites outside the skull and form the main trunk of the third division. This trunk remains undivided for only 2 to 3 millimeters before it splits into small anterior division and large posterior division. Branches of mandibular nerve branches from the undivided nerve main trunk. 1. Nervus spinosus is the meningeal branch of mandibular nerve re-enters the cranium through foramen spinosum to supply dura, mater and mastoid air cells. 2. Medial pterygoid nerve is motor nerve to medial muscle. It gives off Small branches to tensor veli palatini and tensor tympani. Branches from anterior division mainly motor. It is smaller than posterior division. 1. Nerve to lateral pterygoid muscle motor. 2. Nerve to masseter muscle, motor. 3. 2 deep temporal nerves, motor. 4. Long buccal nerve, sensory. Is sensory nerve usually passes between the two heads of lateral pterygoid muscle to reach external surface of that muscle. It provides sensory fibers to supply skin and mucosa of cheek. Buccal mucoperiosteum of lower molars. Mucous membrane of buccal vestibule. Long buccal nerve doesn't innervate lower lip or corner of the mouth, so the buccal nerve block may be administered immediately after completion of inferior alveolar nerve block. Anesthesia of long buccal nerve is important for dental procedures requiring soft tissue manipulation. On the buccal surface of mandibular molars. Branches of posterior division, mainly sensory. It descends for short distance downward and medially to the lateral pterygoid muscle, at which point it branches into 1. Auriculotemporal nerve. It arises by 2 roots, medial and lateral, then unites below foramen spinosum to supply skin in front of the ear and scalp over temporal region. It provides sensory, secretory, and vasomotor fibers to parotid gland. Anterior auricular branches which supplying skin over helix and tragus of ear. Branches to external auditory meatus, and tympanic membrane. Articular branches to posterior portion of temporomandibular joint. Superficial temporal branches, supplying skin over temporal region. 2. Lingual nerve. Horse. It passes downward and medial to lateral pterygoid muscle, as it descends lies between ramus and the medial pterygoid muscle in the pterygomandibular space. It runs anterior and medial to the inferior alveolar nerve. It then continues downward and forward, deep, to pterygomandibular raphe. Then reach the side of base of tongue slightly below and behind mandibular third molar. It has triple relation with submandibular gland duct. Lateral below medial, end by dividing into terminal branch. It supplies anterior 2/3 of tongue as it provides both general and taste sensation, through chorda tympani. Mucosa of floor of mouth. Lingual mucoperiosteum. Secretomotor fibers from chorda tympani to submandibular and sublingual glands. Thanks for watching. Support us by likes and subscribes.